I'm Aditi Dubey, and today we focus our lens a little closer on Germany, a country known for its precision, its science, its efficiency, and also its aging population. At first glance, Germany's cancer profile mirrors that of other high income nations: rising incidence, better survival, and an ongoing challenge to reduce mortality. But underneath that broad picture lies a quieter, more complex story. Let's begin with the numbers. Every year, more than 5 lakh new cancer cases are diagnosed in Germany. That's over 1,300 people every single day. By 2030, this number is projected to climb, not because we are losing the battle, but because people are living longer. And age is the single greatest risk factor for most cancers. Germany is an aging nation. Nearly a quarter of its population is over 65. In places like Baden-Württemberg or Saxony, the graying of society is especially pronounced. And with age comes increased risk of breast and prostate cancers, of collateral tumors, of skin cancers, and blood cancers. But here is where the story takes a turn. Not all regions in Germany carry this burden equally. Eastern Germany, despite being part of an unfight country for over 3 decades, still shows higher mortality for certain cancers, especially lung and cervical cancers. Factors like access to healthcare, historical smoking rates, and socioeconomic conditions play a role. Northern Germany sees elevated rates of collateral cancer. Meanwhile, the southwest tends to do better overall, benefiting from dense healthcare infrastructure, robust insurance coverage, and higher awareness of screening programs. These regional disparities are more than just geography, they are legacies of economics, of policy decisions, of public health outreach, or its absence. They remind us that even in one of Europe's most advanced health systems, where universal insurance is a right, outcomes are not evenly distributed. Not a word about gender. Men in Germany still die from cancer at higher rates than women, partly because of higher historical smoking and alcohol use, but also because men tend to delay checkups, avoid screening, and seek care later when disease is harder to treat. Women, on the other hand, carry the emotional and physical burden of caregiving, often while managing their own risk, like breast and cervical cancer. Fortunately, organized screening programs and HPV vaccination efforts are changing that landscape, especially for the younger generation. One striking observation: in children and young adults, cancer incidence remains rare, but survival has improved dramatically. Pediatric oncology centers across Germany, like those in Berlin and Heidelberg, are achieving outcomes that rival the best in the world. And yet, the system feels the strain. An aging population, a growing demand for oncologists and specialized nurses, rising cost of immunotherapies and precision treatments, rural hospitals closing or struggling to retain staff. It's a quiet pressure building under the surface. Germany stands at a crossroads. It can either lead Europe into a future where equity and innovation go hand in hand, or it can allow cracks to deepen. But East and West, rural and urban, young and old, the path it chooses will shape not only its own cancer burden, but the way neighboring countries look to it for leadership. This isn't just a story of statistics, it's a story of systems and the values that guide them. Thanks for listening.